How's it going, guys? We are going to talk about music-based interventions today, and both me and Tanner created this presentation. So here we go.
So we're just going to start off with a couple objectives here. As you can see, we're really going through of where music therapy came from, how can we use it, and then we're going to really look at some research and some of the techniques and technologies that we can use in our sessions.
So music therapy was first referenced in 1789. It was actually starting to use as an intervention in the early 1800s and saw its first recorded music therapy interventions in an institutional setting. Music-supported therapy is a tool for neurorehabilitation that positively influences neuroplasticity. Now, it should be referenced that music therapy is its own profession outside of the scope of physical therapy. However, many of their techniques and technologies are currently utilized by physical therapists. It's used in conjunction within the rehabilitation setting to improve cognitive, physical, and emotional deficits. Very evidence-based practice. So there's a lot of research that goes into effective treatments that with music interventions.
We're looking at some potential benefits when we pair music and physical therapy. As you can see, there's some good outlooks during therapy sessions. We can improve some motor functions, especially when we're doing any type of task. We can reduce some of the fatigue when we are doing these tasks. There's some research that shows cadence and stride can be improved through rhythmic activities, and there is some potential for microstructural changes in the white matter pathways.
So we are going to look at some research supporting the microstructural changes of music cued therapy. This was done by measuring the arcuate fasciculus structure after using music cued motor training. Now, if you guys remember our neuroanatomy, the arcuate fasciculus was a tract that connected the Wernicke's and Broca's area of the brain. However, researchers also found that there are connections leading to the motor cortex as well. And so for this study, they looked at 30 right-handed volunteers with limited music experience. Now, this was important as previous research showed that lifelong musicians had a healthier arcuate fasciculus than the general population. So they limited the number of years of music experience down to less than 6. Participants would then perform 4 trained and 4 untrained sequences of finger-thumb opposition with their left hand, with the music group receiving an additional soundtrack with temporal cueing. Throughout the study, diffusion tensor imaging was performed to look at the fraction anisotropy of the right arcuate fasciculus. So again, back to our neuroanatomy, left extremity, we will be looking on the right side of the brain. Now, in case you are unfamiliar with fraction anisotropy, it is a scalar value ranging from 0 to 1, in which 0 would indicate disarray or unrestricted water diffusion, and a 1 would indicate diffusion in one axis, or that is aligned and tightly packed. So the closer you get to 1, the more overall healthy the white matter is. Additionally, they looked at any performance differences between the two groups, and this was done for 4 weeks. So along with looking at the MRI, they also wanted to measure performance. And based on the performance of both the controlled and the music group, there was actually no statistical significant difference between either groups. Music group did pair better. However, it was not significant enough to quantify that the music therapy was actually better than just the visual display for cueing. However, what they did when they actually did look at the MRI, they actually noticed that on the right arcuate fasciculus, that there was actually a significant growth in the fractional anisotropy. So it increased, indicating that there was more structural changes occurring on the right arcuate fasciculus. And now what these findings suggest is that even with the performances being similar, structural changes were only apparent in the music group. when we look at neural rehabilitation as a whole, it is highly dependent on structural reorganization. This could indicate that music-induced cueing could be a very beneficial intervention in the neural rehabilitation setting. Now, it also, if you look up on the chart, they actually looked at the left arcuate fasciculus, and neither group saw any significant changes, which was to be expected considering they were training the left hand. So this is another study that looked at music-supported therapy for subacute stroke patients. Pretty straightforward with this study. Study was just testing the effectiveness of music-supported therapy in the rehabilitation setting compared to just conservative care. 40 patients, 20 did the conservative care, 20 did the music-supported therapy sessions, and they looked at the 4 domains of motor function, cognition, mood, and neuroplasticity. Mainly from the findings of the study, they found no significant improvement in motor function and neuroplasticity. However, they did notice that patients did have a better mood overall and felt more motivated to perform their therapy. A big roadblock in many therapy sessions is motivation. So this research just shows the importance of keeping patients motivated and how it can greatly enhance a participant's ability to perform therapy.
Research looks at this tool called the Music Glove, and it was comparing if the Music Glove was actually better than a conventional hand therapy and an isometric grip training. So obviously the purpose of this glove was to see if it was more effective than conventional hand therapy. So they used 12 patients who had recently had a stroke and they had at least moderate hemiparesis. So they all did about 18 sessions of therapy, and they also did a pre and a post test. But the one thing that I liked is they used a blinded rater. So instead of the researchers looking at it, they would actually bring someone in and determine if they were better pre versus post. And they also used this thing called a box and blocks test as the primary outcome, and that was basically you measure unilateral gross manual dexterity. It's actually really quick, it's simple, and it's a very inexpensive test. And it's kind of nice because it can be used in a wide variety of populations, especially with strokes. And then they also use this intrinsic movement inventory, and that evaluates interest and enjoyment in a task, along with several other factors, such as perceived competence in the activity and perceived choice in doing the activity, which basically indicates how self-motivated they are when they're doing therapy. And here's some results of the Music Glove therapy versus conventional hand therapy. It shows that when using the Music Glove, we were able to grasp smaller objects. And based on that box and block score and the 9-hole peg test, and the 9-hole peg test basically is just to measure finger dexterity in patients with various neurological diagnoses. But it showed that the P was less than 0.05. It was actually 0.010. And then the one thing that I also liked is after a 1-month follow-up, we see that the individuals still using the Music Glove had sustained hand function. And they were also more motivated to use the tool more than the actual conventional therapy. And that's what kind of these graphs to the right are looking at. They're looking at pre and post test of the box and block score, the change in the 9-hole peg test score, and if you see, they're always improving. And then at that bottom graph, it shows where they started and where they ended. And even after they ended, after the follow-up, you see there's still a little bit of improvement with the Music Glove. All right, so here's a few more graphs from the Music Glove therapy. As you see, the graph to the left shows that dexterity versus speed. So they looked at it from day 1 to the end of day 6, which were those 18 therapy sessions. And in both scenarios, both dexterity and speed increased significantly. And if we look to the graph on the top right, that was a questionnaire, satisfaction questionnaire that they did. And as you see, people that use the music glove preferred that way more than any of the ISO trainer, which is actually really nice because that's how we saw that improved after the 1 month follow-up, that they were still making improvements because they were still able to use that music glove. And then that bottom right corner shows kind of all of them: dexterity, speed, grip, and strength, which is really nice because you can see how all 4 aspects actually improved as they went on with treatment, and they were testing individual pincer grips from digits 2, 3, 4, and 5. This is another study showing how music training can enhance the executive functions and specifically Parkinson's disease. So the purpose of this study was to determine if exercising what is called the cerebellar thalamocortical network will actually enhance these executive functions. So there was about 119 patients who had Parkinson's disease, and they were either cognitively intact, maybe they had a couple minor deficits, maybe some moderate to severe. And what they did is they used brain imaging on 105 of those patients, but they set aside 37 patients who were the control. So they were cognitively intact and they were at that baseline. So for 18 months, most of the individuals played the piano. But for those 37 who didn't play the piano, they actually demonstrated that prefrontal cortex thinning, and it was very significant. And I will note that a lot of these individuals were not musicians, so they were actually learning how to play the piano. And here is the cerebellothalamocortical network. It's just demonstrating that there's a connection of the cerebellum and the telencephalon, in particular with the cerebral cortex. So that CTC network was important because it showed that when playing music, it'll actually activate it, and that activates executive functions through fine motor skills. So when they were playing the piano, it actually activated that CTC. And when we repeated that practice, it showed that CTC networks can actually assist with deficits in Parkinson's disease. So if we exercise these decision-making, planning, and problem-solving through this facilitated music experience, it may actually help with neurological deficits.
Rhythmic auditory stimulation was first used by physical therapists in the mid-1990s and is continuously being used in the neurorehabilitation setting to this day. It is often used in gait training for a variety of neurological conditions. It is also used in the upper extremity training as well, however not as prevalently. It involves the use of acoustic rhythm to signal the speed of cadence during gait training to allow patients to synchronize their foot placement. A couple of potential benefits include increased stride length and symmetry, improved speed of gait, as well as an even distribution of weight shifting. Movement sonification is a bit of a different approach to music-supported therapy and therefore currently being studied as a tool for physical therapy. Comparatively, where rhythmic auditory stimulation is about synchronous movement, movement sonification is an auditory feedback where audio is a representation of information for an otherwise non-audible task. For example, if a patient were to abduct their shoulder. It is also referred to as real-time kinetic auditory feedback. This intervention approach involves mapping of a movement parameter and utilizing a sound component with little or no latency, so that the feedback that the patient receives is continuous throughout the entire motion. This feedback can utilize inhibitory or motivating movement patterns. It also has been used as support for learning or adapting fine motor skills, as well as inducing neuroplasticity.
So this is one of the tools that I actually did the research on, was a music glove. And what I really wanted to say is it was about $350, and it's cool because it's one of the only FDA-approved neuro rehab tools for mobility in the hands and fingers. And one other really cool thing is if you don't, because this usually is easier to use with a tablet, almost looks like a Guitar Hero in a sense, but just for your hand. They also sell the glove, the program, and the tablet for about $549. And if you guys want any more information, I provided a link that goes to their website and talks about it a little bit more. And then the last thing is there are so many free apps out there for music therapy. I provided a few. This was off of a certified music therapist website, and it was actually super cool because they provide a vast amount. But this is just some simple ways that you can have your patient do at home, and they might actually enjoy their exercises a lot more.